Sorry, everyone, for a couple-minute delay. Dad, it's good to see you, even virtually.
Thank you. I'm glad to be available virtually.
I know it was the dodge of the wire here at the last second, trying to get some of the technology to work. So thanks for going through that. And thank you for, it looks like we got about 80 people in now. I know we'll have some more that trickle in the first
Fantastic.
5 minutes or so and throughout the hour that we'll have together. And so before I kind of walk us through where we're going to head today with the conversation, Dad, thanks for being able to make space across this hour and with all the things you're doing to speak to us. To speak to our donors and partners to kind of help us get a sense of where this thing is headed as a pandemic and what God's speaking to us in the midst of it. So thanks for making the time. So let me kind of give us a sense of where this hour is going to go. And thank you all for being here. So we're in Zoom webinar style to speak to the technology just for a second. And so just so you know, we cannot see your camera. Other people cannot see your camera if you are already muted. For this presentation, because of how many people we anticipate being here and the fact that we are recording this to distribute to those that couldn't make it here, if you could keep yourself muted, that'd be really beneficial. But really the vision for this time is simply, as we were praying and thinking through, how do we resource believers? And really what is an unprecedented time in human history, at least in the last century, of something that we're facing as a people globally. One of the things that is so challenging is that while we're socially distant, we don't have to be spiritually distant, and there's an encouragement there for us. And so how could we as Denison Ministries, especially for you as our donors and partners, make ourselves available just to let you know that we are here for you. We know how challenging this is for you personally, for your families, for your businesses, that we want to be able to help you get a sense of where this is going. I personally, in my own life, really appreciated my whole life being able to access that as a resource to understanding both the textbooks that I was reading and studying, understanding scripture, understanding theology and society and geopolitics and all these things that Dad is so great at being really a leading voice in those spaces. And so I've loved getting to access him in this season personally as trying to figure out where this thing is going and for our organization. And so we just had this idea of what if we did the same thing for those that are our financial partners, to help them get access to you, Dad, to be able to be a resource and a voice in this space to get a sense of where this thing is going physically, related to health and spiritually as well. So that's the heart behind this. Really for what we're going to do for the time, Dad's going to take just about 10 minutes or so to present really the most up-to-date information that he has around where this pandemic is heading, and be able to speak in some thoughts that he has related to wisdom for this and discernment for this, of how God's moving as well and wants to move in the hearts of us as a people. We're going to make the majority of this time just simply for him to be accessible to you. So I'll play MC and host today to be able to field questions that you might have. You'll see, for those that are attending, on the bottom of your screen, there should be something that says Q&A on the bottom, question and answer. That's a spot that you can use to be able to post your questions either anonymously, or you can actually have your name behind that if you wish, so we can know who posed the question. I'll look as Dad is addressing the pandemic itself first, and then addressing these questions as they roll out. Look for common threads among the questions that are asked to figure out what are kind of the highest felt need questions. And then we can send out some additional resources after the hour's wrapped up as well, if we run out of time to address the questions that are posed today. So that's the tool that's there, the functionality, Q&A. Even as Dad presents on this pandemic for about 10 minutes or so, feel free to go ahead and start posting questions there so we can start to monitor the common threads among those questions and get rolling with the majority of your time today. That'll be Q&A. We did invite the whole of Denison Ministries donors to the call today. And so I think there are some people here that might not be fully aware, Dad, of who you are and your background and your bio, if you're maybe a First 15 reader or a Christian parenting reader. And so for the sake of making quick introductions, Dad is the Chief Vision Officer for Denison Ministries and the founder of the Denison Forum. In March alone, the Denison Forum reached about 1.7 million people in audience. Even this month, Dad was featured in Christianity Today. He's been on radio stations all around the country, as he really is a leading voice in the spiritual and societal effects of this pandemic. He's the author of the daily article. If you're not signed up for the daily article, you can go to denisonforum.org to sign up for it for free. In addition, he's the author of multiple books. He is an influencer inside of multiple organizations, among which he's the resident scholar for ethics of Baylor Scott White Health, which also gives him, I think, an ability to speak into this pandemic in a really unique way that I'm excited for us to take advantage of today. Most importantly, he's the father of 2 sons, of which I am the youngest and the best. I will say, since the oldest son, while he's, I think, on this call today, cannot speak and do his, whether he's the favorite or not, I'll go ahead and say that I am the favorite. He's also the grandfather of 4 grandchildren. I will say, after being stuck at home with 2 of those grandchildren, I will not claim them to be the best of the 4. Being stuck in a house with them for a few weeks can take a toll on any family, as much as I love them. So he's the father of 2 sons, grandfather of 4 children, grandchildren, and Dad, we're grateful that you're able to speak into where this pandemic is heading. If you're a Denison Forum reader, you're not sure who I am or why I'm here, my name is Craig Denison. Alongside with Dad, I get to help lead Denison Ministries. I also write a daily devotional called First 15 that resources a little over 1 million people to be able to start their days in scripture and worship and prayer and in reading to help them get connected to a sense of abiding connection with God on a daily basis. So that gets us kind of a sense of introduction, Dad. If you want to, I'd love if you just launch first for about 10 minutes into really, as we look at life after the pandemic. If you want to speak to the paper that we were able to send to this group of people or participants before this meeting today. If you weren't able to get access to that paper, we'll post in the comments a fresh link to it so that you can see it once the meeting is wrapping up. Be able to get some current sense of where this pandemic is heading. But if you would take about 10 minutes and give us a sense of where you see this pandemic heading and how you see life after the pandemic.
Well, Craig, thank you so much. First of all, I hate to start by disagreeing with my son, but brilliant and perfect. They inherited original sin, skipped them, a son earlier today, and he was making the same claim you're making, Craig, that it's somehow difficult to be with these children on a full-time basis for all of these weeks. And I just don't understand that. I really have no way of overlapping with that. Perfect grandchildren, that's just how this works, right? In fact, if we had Wes and Wells on this call right now, no one would only be talking to them, and I imagine they'd be pretty happy about that. So thank you for the chance to do this, and to our donors that are on this call with us and those that will hear this later. First of all, as Craig has said, I just want to express my incredible gratitude to you for what you're doing to make this ministry possible. We're entirely a donor-funded ministry. We have no other outside sources of revenue or support, and during these days, you've been so incredibly generous and faithful to this ministry. You've allowed us to do what we do right now. We're accessing more than 3 million people right now through the various resources of this ministry. And at a time like this, unprecedented crisis is in many ways an unprecedented opportunity for the gospel. And we'll talk about that some today. But we wanted to do this as a thank you to you. We exist to equip the saints for the work of the ministry, to help build culture-changing Christians, to help Christians use their influence more effectively. And so if we can do that in this context across this hour, we're delighted to do that, honored to be able to do that. But we just want you to know that we're just so grateful to you and for you. This is in no sense a fundraising thing at all. This is only our desire to express our gratitude to you and to try to be a resource to you as you use your influence for the sake of the kingdom. So the purpose of the conversation, as we're trying to focus in on this, is to look a little more at what's life on the other side of this. What does life look like on the other side of this pandemic, and how do we get from here to there? I'm not going to try to overview the paper itself. It's pretty large, has lots of links in it, lots of information there that I hope is helpful to you. So rather than do that, let me update a couple things that have happened just today. And even this week, Craig mentioned my relationship with Baylor Scott White Health. For those that aren't in this area, that's the largest not-for-profit healthcare system in the state of Texas. Maybe the 4th largest in the country, something like that. I've been working in this capacity a number of years for them, working on issues of medical ethics and theological background, that sort of thing. I was on a conference call just 2 days ago with the board of the Baylor University Medical Center, which is our flagship hospital in downtown Dallas, as we're doing an update again on where we are with the virus. What does this meaning from a healthcare perspective? What is this meaning for us going forward? I've been writing papers for them in the context of triage medicine and various ethical issues we're dealing with. So that gives me some background for dealing with this that might be a little different from the typical. It also gives me access to conversation and research and resources that are not things that you would see just in a typical kind of a format. And so it's out of that background and that context that we came to this conversation. So a few things that we know right now that we didn't know even a few days ago. First of all, as we're thinking about what this is going to mean for us on a go-forward basis, there's some stuff out just today relative to telecommuting and what the office is going to look like and what small towns are going to look like. There's an article that's out today in the Wall Street Journal, for instance, that's describing an exodus out of New York City as people are trying to flee the congestion of that environment in the context of communicating disease. And the belief is that we're going to see a large number of them not come back. That we're going to see people discovering they can telecommute from small towns and not have to pay the price to live in a major city, not have to deal with ongoing disease threats that you'd see in a major city. So we think there will be a real resurgence of small towns as a result of this. Some of that's in the paper, but even in recent days, we're seeing that trend continue to grow. We're seeing a trend right now relative to what offices will look like on the other side of that. For those that do come into offices, you could imagine that people are wanting to use this from a financial point of view as best they can. They're trying right now to make plans for the future. So I saw something today about a design for what's known as a 6-foot office. It's an office design with literal lines on the floor showing you what desks would look like when they're 6 feet apart. Right now, they're trying to retrofit elevators so that they will have a sensor that notices when you walk up and you don't have to touch anything to get the doors to open. And they're trying to retrofit elevators right now so they'll obey voice commands so that when you get on the elevator, you won't have to push the buttons. We're looking right now at UV lighting for our office environment, because that would allow for a greater level of sterilization in the space once that again becomes something we're doing. And we're going to see a whole new level, we think, of telecommuting. Prior to the pandemic, 4% of American workers telecommuted at least 50% of the time, worked at distance at least 50% of the time, 4%. Today, it's 34% that are working from home. A lot of them would have said before the pandemic that they can't do this, that they don't want to do this. A lot of employers would have said they can't maintain accountability if they do this, but now they're forced to do it and finding that they have to do it. And what we're discovering is that you could do accountability even more effectively in some ways, depending on how you do this. And workers are discovering that they can do this on a whole new level. And so that's just one piece I wanted to mention that's been in the news just the last couple of days. The other that everybody's talking about, and we'll probably get into some Q&A in just a minute about this, has to do with where we are right now with testing as a means of reopening the economy, reopening the nation, as it were. And what do we look like there? So I can try to clarify this a little bit. It's on 4 levels. On one level, we want to be able to test those that have been infected and have recovered. That's the antibodies test that you're looking at. Right now, they're not very available. At Baylor, we hope by May to be able to test 3,000 a day with these antibody tests that are coming down the way that are going to be a way of discovering who has been through this. 25% of people with coronavirus have no symptoms. So right now they've recovered and they don't know it. The theory is that they possess some kind of immunity on the other side of having recovered from this. That itself is not yet known. We don't fully know if they're immune, and if they are, to what degree. This is continuing to mutate. There are now 30 different strains of this particular novel coronavirus, we think, and we're not certain if you had this strain, are you immune to that strain? It's part of the reason that a flu shot, even on a good year, is only 45 or 50% effective, because the flu virus just mutates from the time the flu shot was developed to the time that you actually take it. And there are several, actually 4 different strains that we call flu. So anyway, one piece is, how do we test people that have had it in the theory that they have now some immunity? They could then be on the front lines of healthcare. They could go back to work more effectively. They could volunteer more effectively. So that's one piece. That's a huge part of this relative to opening. If we discover that some community has what's known as herd immunity, they have some 70 to 85% actually have been through it and now have immunity, then we could open that community more quickly, more effectively, is the idea. So that's one piece. A second piece is testing those who have it right now but don't know it, but nonetheless are infectious. Again, 25% have no immunity, another 25% have no symptoms, another 25% don't have severe symptoms. They might have a headache, they might have a cough, they might have respiratory issues, but they're not aware that they have anything more than that. They nonetheless are infectious. We want to find those people so we can isolate them. And in a community, to open that community, you needed how many people are infectious and what you're doing to keep them from infecting other people, obviously. On a third level, we need to know the people that are out there that have pre-existing conditions, because they're more likely, obviously, to be susceptible to stage 3 of this, which is where it becomes lethal. And in that context, you would think that's pretty simple. You would think that people with pre-existing conditions would know it, but that's not necessarily the case. Just this morning, it was reported that in New York's largest healthcare system, 50% of the COVID fatalities were related to high blood pressure, to hypertension. That's the #1 underlying symptom we're now discovering. 41% is obesity, 34% is diabetes. Well, the problem with hypertension is 11 million Americans don't know they have it. It's called the silent killer. You can have high blood pressure and not know it. So therefore, you're at the highest risk for COVID, and yet you're not aware of that. So on that third level, how can we do testing to identify those people that are most at risk and be able to protect them as we open a community, as we try to move forward inside all of this? And then on a fourth level of testing, I know it gets confusing, and I'll stop with this and we'll get into some Q&A. It's just the thing people keep wanting to ask about. The fourth level is the efficacy of the testing methods themselves. So let's say you've contracted coronavirus, SARS-CoV-2. Its first stage is going to be in your nasal passages. We can test for that with the swabs you keep hearing about. It's not a pleasant test, but it certainly doesn't take long. And that's these drive-through things that you're seeing where people are coming in being tested and you're seeing the pictures. That's what they're doing. They're testing with a swab up into the nasal cavity. That's fairly effective. We think it may be even 85% effective for virus that is there. Here's the problem. Stage 2 is when the virus moves from the nasal capacity down into the breathing apparatus, down toward the lungs. Once it starts moving there, it's much less present in the nasal areas. So you might be at stage 2 of this, get tested with swab, it comes back negative. And therefore, we think you don't have the disease, when actually you're progressing toward the more serious stage of the disease. And that's why testing with the swabs can be problematic, because you're moving to stage 2 and don't yet know it. That's why we need antibody tests that will detect the presence of the virus in your system on a level that the swab won't detect. And then, unfortunately, for 20% of the cases, it moves to stage 3, which is when breathing starts to be compromised. And now you're talking about possibly ventilators, certainly hospital care and all of that. So all that to say, this is an unprecedented disease for us. We're not aware of any time, certainly in living memory, that you'd have to go back to 1918 and the flu pandemic, sometimes called the Spanish flu, although it didn't originate in Spain, to look at something like this from a societal perspective. But even back then, you didn't have people that had it and didn't know it. You didn't have people who had it for 4 or 5 days before they became symptomatic, but were nonetheless infectious. We just didn't have that dimension to this. That's not the case with the seasonal flu now. If you have it, you know it pretty quickly. We don't have people walking around that have it and don't know it. So how will this turn out? One option is that it's a one-off, that it's a singular event like the 2002-2003 SARS epidemic. It just kind of goes away. That's very unlikely. That's certainly a thing to pray for. A second is that it's seasonal. We don't yet know if it's going to recess a little bit as we get into summer, as the seasonal flu does. We certainly hope so. That would help us in the northern hemisphere. It wouldn't be helpful in the southern hemisphere as we're moving into fall and winter right now, but that would be helpful on the north. A third is that we'll see a spike this fall. CDC director yesterday was warning of a serious spike this fall that could be worse than what we're seeing now, because we'll see flu come back in the fall. And we could overwhelm our healthcare system, not only with seasonal flu this fall, but with a respike of this. It could be that we see a recess in the north, but it moves to the south, and then people travel from the south to the north this fall, and we see a spike with that as well. Then a fourth outcome, the worst outcome, is that we're never able to eradicate this, that we're never able to get to that vaccine that we're hoping for, at least by next summer, that vaccinates us, such as smallpox has been vaccinated and polio has been vaccinated. I don't want to scare you, but it's possible. We don't think it's likely, but it's possible that this particular virus will mutate in such a way that we'll constantly be chasing it, that we'll have vaccines for certain strains, but not other strains like we do with the flu. Now, the good news is, and I'll end with this, the good news is that we're moving much more rapidly toward therapies. They're not vaccines. They're not keeping you from getting it, but they're treating the symptoms in such a way that you're much less likely to get to stage 3, much less likely to die of this or be severely affected by it, have long-term complication from it. If we could get to the place that what we call COVID-19 is like the seasonal flu. Some people do die of the flu every year, but the seasonal flu doesn't keep us inside. The seasonal flu doesn't shut down our economy. The seasonal flu doesn't keep churches from meeting and so forth. If we could get to the place with therapies, with serum treatments from people that have been infected and other things that are in the pipeline right now, then we could manage this, even as we're waiting for a vaccine. That's the thing to pray for right now. If you're praying for a medical outcome, pray for that. Pray for existing therapies that are already FDA approved, so we don't have to go through that entire testing process, but are discovered to help with the symptoms of this. There's one particular therapy coming out of Israel right now, which seems to be effective in dealing with severe respiratory results of coronavirus, which is how 50% of its deaths occur. And it could be that if that turns out to be effective, that it would be a game changer in terms of the mortality rate of all of this. So it's a lot of stuff in a short period of time. But as regards where we're going, I wanted to kind of bring us up to speed from some things since the paper was developed and look at it from a medical and a medical ethics perspective. So I'll stop there. Sorry about the data dump, but I'll stop there and we'll see what questions you have that we could spend the rest of the time on.
That's a great, Dad. Thank you for that. So there's a number of questions that have been posted inside of the Q&A tool. Feel free, again, if you guys would like to post any questions, feel free to use that tool to post them. And we'll spend the next 30 minutes or so running through these questions before we start a time of prayer and wrap up for our hour-long conversation today. So there's two questions here. One from Casey that says, do you see this pandemic as an Old Testament act of God to get our attention and call us to repentance? There's a similar, not entirely related question that says, is this pandemic God's punishment upon this world? As a question, I think there's some relation there. So maybe you could speak to kind of that concept that I know is going around. And then you had a fascinating piece that I think even came out this week addressing that question. So we'd love your thoughts on that.
You bet. And I'll try to do it briefly. Janet, my wife says, when they ask you what time it is, you don't always have to tell them how to build a watch. So I'll try to do this as quickly as I don't know what she means by that, but I'll try to do this as quickly as I can. Had an article that was published by Christianity Today this week on that very subject. Is this the judgment of God, specifically in an Old Testament sense or in a larger sense of that? My answer is no. My answer is that it is not, relative to the biblical conditions that we find in Scripture that would apply to something like this. And here's what I mean very quickly. In the Bible, there's no question that God uses disease as specific judgment. You see that with the plagues in the Old Testament. You see that with Miriam that contracted leprosy after she was abusive toward Moses. You see that in Acts chapter 12 with Herod, King Herod, who refused to give glory to God and was eaten with worms and died. Even Josephus talks about that event. But those are diseases that are clearly supernatural in origin. Those are diseases that don't have a natural component, a natural explanation. Wherever we think this came from, and that is much debated right now. Did it originate in the wet market of Wuhan? Did it come from the lab? Where else did it come from? Nobody that I know of thinks that it was bioengineered. Everybody that I'm aware of thinks that it was naturally occurring. It was a naturally mutating virus. However, it got into the human population. That's a whole nother subject. And so it doesn't really match the biblical description of a supernatural orientation or origin for this disease. So that's one reason I don't see it as an Old Testament plague or a specific judgment. The second is that in the Bible, when you see God using plagues and other things as judgment, it's against specific sinners for specific sins. It's not a generic thing like this. This started in Wuhan as best we know. Well, I'm not aware of any particular sins that are unique to the Wuhan context. I certainly wouldn't say that's the case globally necessarily. It's not, if there were judgment on communism, then how did it get outside of communist China? If it was God's judgment against the dictatorship that was there trying to overthrow, let's say, Xi Jinping, then how did it escape? Why did God allow it to escape China? If it was God's judgment on radical Muslims in Iran, then why aren't the Iranians the only people dealing with it? So when you see the judgment again in Egypt, it was against Pharaoh. It was against his hardened heart and that specific nation because of that specific sin. So I don't see it as that kind of judgment. I will hasten to add this. It is, however, an example of the fallen world that is God's judgment on sin in that sense. As you know, when humanity fell, all of creation fell. Romans chapter 8 says that the creation groans and travail now. And that's why we have diseases and disasters. That's why 5 people died overnight as a result of tornadoes in Oklahoma and Texas. Another man drowned in a flood in Louisiana overnight. That's why we had an earthquake in Los Angeles earlier this week. We live in a broken world. We wouldn't be having this conversation in the Garden of Eden. So you can see it more generically as a result of sin, but I don't see it as a specific thing. I will add this. It is nonetheless clearly God's call back to himself. We're aware of mortality now on a level that most people weren't willing to admit even a couple months ago. We'll get more into this in a little bit, I'm sure, but we're seeing an incredible response for the gospel as a result of all of this. I'll mention one church in California that had 8,000 people on their online service before the pandemic, that had 1.3 million people watching online on Easter Sunday. Our own web traffic has more than doubled in recent weeks. We're seeing, and I give you more examples of that, but we're seeing God redeem this in incredible ways. And so God's using it to call us to himself, as though it were a judgment. That's the positive side. He's certainly using it and the fear of mortality that's coming from this to call people to himself. So great question. It's very much a question a lot of folk are asking these days.
Thanks for that, Dad. There's a question here that I think takes some of the concepts you just laid out and maybe personalizes them for people in a way. The question is, where is God when COVID-19 kills my business? I think that speaks to this idea of God is all powerful and all loving. And how do we wrestle with personal suffering in the midst of that awareness when suffering is so, I think, evident to us as a
Yeah.
global people right now? And so just a quick softball to throw your way of how do you relate to the all-powerful, all-loving nature of God with suffering in the world? And so if you could take just maybe 30 seconds and answer
Yeah,
that for all
I'll
of
do
us
that.
for
We'll
the
solve
time,
that in
that would
30
be great.
seconds. All right.
That
Yeah,
would be
we'll get
great.
that all
Thank you.
nailed down, of course. Yeah. And I know the questioner doesn't think that at all. And if in fact they have lost their business or are losing their business, I am so sorry. I am so very, very sorry. That is going to be one of the outcomes of this. We're going to see some people that are doing new things because of this that they'll keep on doing, and you'll see businesses that'll be enhanced. You see Amazon hiring 100,000 workers. I mentioned before, people are redesigning offices and are going to have new businesses on the other side of that. Netflix that has mushroomed. I think I read, wouldn't want to be quoted, but I think I read Jeff Bezos has made $42 billion during this time because of Amazon usage and all of that. Then on that third level, you're seeing whole industries that probably will never come back as they are right now. You can't flip that switch very easily. Gold's Gym in Dallas has closed permanently, it looks like. They don't believe they're ever going to be able to come back and reopen. Then in the middle, you're going to see some people that are going to take a long time to come back from this. People that are waitresses in restaurants can't do their work online. People that work in factories can't do that online, and they may get back eventually, but it's going to be a long process. It's not really a one answer deal. So relative to someone that is losing or has lost their business because of this, you're exactly right, Craig. We Christians have a unique problem here. We say God is all knowing, he's all loving, and he's all powerful. We're the only world religion that, I don't mean to be unkind, but they would agree, the only world religion that fully believes all three of those facts. So God knew about the pandemic before we did. He loves us so much he wouldn't want us to lose our business. He's so powerful he doesn't have to allow that. So why did he? There's not one answer. Rather, there are biblical approaches. One biblical fact is God suffers as we suffer. That's one fact. He hurts as we hurt. He wept at the grave of Lazarus. You're in his hand and nothing can come to you without coming through him. He grieves as you grieve. A second fact is he sees a future we can't see now. Paul says, I don't consider the present sufferings worth comparing to the glory to be revealed. And I will hope and pray that one day you'll look back and see how God was using this to move you in some direction for which you're even more grateful. As difficult, painful as it is now, there's going to be an open door on the other side of this that will one day make sense of this. And we can pray for that, for wisdom and direction with kind of a future hope model inside this. A third approach is to ask God, how would you use this in my own life right now? How would you draw me closer to you? How could I learn spiritually? How could my soul be built as a result of all of this? But at the end of the day, the bottom line is I'm convinced, and I've said this a lot over the years, God redeems what he allows. I'm convinced that God is redeeming this for some greater purpose, even though we don't know it now, may never know it fully till we're in heaven. He is with you in this. He is working with you through this. You can trust him with that. You can pray. He promises in Philippians 4:13, he'll meet all our needs according to his riches and glory by Christ Jesus. It says in Philippians 4:6 and 7, if we'll not worry but pray, then we'll have a peace of God that passes all understanding. So I don't mean at all to be surface about this. That is an absolute tragedy, and I'm I have good friends that are in that very position right now. I have a dear friend, in fact, that's really struggling right now to try to keep his business afloat that was thriving 3 months ago and is in a position he's never been in his entire vocational life. And unfortunately, we're going to see even more of this, I think, in coming months. But God hurts with you. God wants to use this in your life spiritually. God's building toward the future, and God is redeeming in ways that we can't understand right now. That would be a short answer. It takes a whole semester to do that in a seminary class, but that's a short answer to the toughest question.
Thanks, Dad. I want to reiterate for this year, whose businesses are suffering, we're praying for you.
Yes.
And we're here for you. If you need someone to pray for you specifically for any purpose or pray with you for any reason, our team is here. We are here for you. And so at the end, we'll make sure that we send you out a way that you can contact us. But the simple way is if you just email contact@denisonministries.org, then we can get that message over to the right person and be able to reach out and be able to pray with and for you in this season of tremendous suffering. So many people are suffering in so many ways, so many of which would be the headline in any normal month or week timeline if it wasn't for all the ways that this pandemic is affecting us in every corner of society right now. And so, but especially there are industries, there are those that are poor and those that are already predisposed towards medical conditions that are especially suffering right now. And it's, we want to pray for and with you. If we could speak, moving out of some of the apologetic questions into just
Mhm.
some of the factual questions of how this
Yeah.
is affecting us right now, where this thing is headed. Bob Payton asks, the original reason for shutting down the economy was to flatten the curve.
Mhm.
Now we realize that every major population center has their own curve. The many who seem to be calling to keep the things closed down point towards keeping people safe, reducing deaths, all worthwhile endeavors, but at what price? So my question is, what are you hearing from your healthcare connections? Are they still focused on flattening the curve, or has the healthcare industry dialogue morphed?
Terrific question. I can only speak out of the Baylor context. And unfortunately, my job is to take a simple question and make it complex. That's what I'm doing here. That's my calling, is to make simple things complex. Unfortunately, it's kind of on three levels, and I'll try to do these real quickly. On one level, one perspective, one way to look at this: if we were thinking only about outcomes relative to COVID, then we would want to keep the economy shut down till we had a vaccine and everybody was vaccinated. And we had proof that the virus was not going to mutate in such a way that the virus is no longer effective, that the vaccine's no longer effective. I mean, we'd want to shut you down for years if that was the only thing we're concerned about here, or if that was really the only issue here is how to keep people as safe as possible. That's what we would have to do. Obviously, we know that is impossible, but that would be the pure medical approach if this was the only issue. On a second level, we're aware at Baylor that COVID is not the only disease that we're dealing with here. It's not the only medical condition we're dealing with. We're very concerned. We talked about this 2 days ago, about the fact that we're not seeing nearly as many heart patients, stroke patients, accident patients as we typically do. Now, part of that is because people don't think they'll get in, because there's been said that we certainly have stopped all elective procedures so as to make bandwidth for patients, but we in Dallas have not seen what we've seen in New York City. We've not seen the kind of capacity issues such that if you had another medical issue, we couldn't see you. We haven't seen that. What we do think is that people with medical conditions are afraid of being infected with COVID and therefore aren't going to the hospital, and that's going to make their other medical conditions only worse. And so the sooner we can kind of get back to some normalcy in this, the better for people with non-COVID conditions. So that's a second piece of this. A third piece of this is the mental health dimensions of all of this, of which we're very aware also. And those two, first and third, work directly against each other to the degree that you're wanting essentially to isolate everybody until we know we have an effective vaccine against every mutation of SARS-CoV-2. And that works directly against the depression rates that we're seeing right now, the addiction issues that we're seeing right now, the child abuse issues, tragically, the spousal abuse issues that we're tragically seeing, all the things that are coming from people that are being forced to quarantine. And that doesn't even speak to the social issues of raising children at home, of people missing their graduations and proms and all that's inside all of that. And so we're thinking as medical providers relative to those larger dynamics as well. So what we're hoping for, I mentioned this briefly before, is the kind of therapeutic approach where we can drive down the worst outcomes. We can drive down the mortality rate of this to a degree that we can tolerate reopening the economy relative to being able to treat other patients and being able to deal with mental health conditions and social health conditions. That's what we're working most for now and hoping most for now, is that we'll have a herd immunity that actually works, and that we'll have therapies that will help with outcomes as this moves into stage 2 and 3. That's what we're hoping for. And at that point, we have to answer the question finally. We certainly would want the economy to be open more quickly than a year or two, when the vaccines themselves might actually be fully effective. And so we're just moving toward that. And I will add this, there's no one size fits all in that. As we're figuring out how to open economies, even from a medical perspective, it's all a matter of demographics. It has to do with, let's take Dallas as an example, where we happen to be right now. You can't answer that question for Dallas. You have to answer it for specific communities within Dallas. Some areas within Dallas have a higher percentage of at-risk persons, and you'd want to open more carefully there than you might someplace else. Some might be tested and discover that they have antibodies, demonstrating that they have some immunity to the disease. Some might have underlying conditions you'd want to be dealing with. Some might be discovered to be infectious. So you'd want to be dealing with on a variety of levels. And you have to ultimately, to open an economy right now, you have to have a suppressed caseload for at least 14 days. You have to have health capacities relative to the hospital. You have to be able to test people that are symptomatic, and you have to be able to follow up what's called contact testing for people that have been exposed. Until we get to that place, we can't open any place. But healthcare providers, bottom line, would want to open more quickly than simply vaccine would allow, but we want to do it as carefully as possible lest we see a spike. that gets back to the reason we flattened the curve to start with, which was the concern about running out of ICU beds, running out of ventilators, having to triage medicine on massive levels. That's the thing we most don't want to see happen. And that would be the thing we're working against.
Thanks for that. And I see, to reiterate some of the functionality, I see some hands raised as a Zoom tool inside of the attendee list. If you have a question, feel free to post those inside the Q&A tool. If you didn't happen to capture that in the first few minutes of the time together, we see there's a ton of questions in here that are so great. One question, Christina Sampson. Christina, hi, thanks for being here, asks, is to say, do you see companies in the US moving away from manufacturing offshoring in China because of all this? If so, how far away are we from dependence on China? I think even if you could take that and draw it out a little bit and speak to kind of the geopolitical ramifications of this, obviously the world is flat as a concept now. And so we're so interdependent on one another and connected for our economies, for so many parts of those things that help us thrive as a society, as a global society now. And so if you could speak to some of the things that we know now as geopolitical ramifications of this, I think that's a question a lot of people have right now.
Terrific. Yeah, it's a great question. And it certainly is, it's critical to where we are with this as a future. And it's on two levels. On one level, we're already right now having to do things domestically just because we can't get them from overseas. Whether it's masks that we're waiting on, whether, for instance, they're N95, what's known as HN95 masks that are manufactured in China that we can get at Baylor, but they're quite frankly not as functional. They don't pass as many test standards. They're not up to the standard that we wish they were. I don't mean that specific to China or generically relative to Chinese manufacturing, but on those masks anyway, that's the case right now. And so we're having to do some things domestically that we used to export, whether it's to China or someplace else for cost benefit savings. And then we're seeing the supply line issues being massive problems here. Even if the swabs are available in Maine, we can't get them down to Texas without, we're having to wait on that because of supply chain. If you've tried to order masks online right now, you're discovering that it's 10 to 14 days before they can get delivered, and typically they're getting delayed and delayed. It's not that they can't get the masks, it's that they can't get you the masks because we don't have enough truck drivers, we don't have enough transit systems and all of that. So on one level, it's already happening, that we're being forced to more domestic production as opposed to overseas production. Whether it will revert back to the way it was, assuming that we get back to some level of normalcy quickly with all of this from a geopolitical perspective, is the question. And again, there's no one answer to that. It depends on the industry. It depends on the specific place to which it was outsourced. There's a great deal of frustration with Chinese bureaucracy right now, as you can understand, not only relative to transparency issues with this from the beginning and relative to issues as regards their complicity in this, all the issues inside that, but also the question as to whether we can trust them even on a manufacturing level. Are we discovering some things about their government or some things about their truth-telling apparatus that will make us see them as less trustworthy a business partner in the future? And that's not just China, but that would just be one example of that. Some industries are already talking about wanting to bring things back and make them more domestic. They think we now have the technology to compete with China from a financial perspective that maybe we didn't have before. So maybe we can still be cost effective and build locally as opposed to overseas and not have to risk this sort of thing. Other industries are going to try to find geopolitical solutions that are COVID proof, as it were, trying to use automated technology, trying to use robots, trying to use drones to do deliveries and that sort of thing, so that if there is another one of these, we won't have the same impact. And they can still manufacture overseas at a huge cost savings, 1/8 of what it would take domestically or whatever. So you're going to see some of that as well. Then there's a third piece inside this, which is really the patriotism piece. And that is the degree to which Americans will pay more for something made in America than they would for something paid overseas, as a way of bringing back the economy, as a way of supporting the nation at a time like this. And you're going to see a kind of a COVID dividend, just like there was kind of a peace dividend after the war, that I think is going to be at play with some providers and some products down the way. So bottom line, it will never be the same. It will never be exactly what it was. It's like asking, will the world be the same after World War II as it was before World War II? And the answer obviously is no. Different economies overseas will recover in different ways, and different geopolitical relations are going to be affected by this. Iran right now is making some threats relative to some transit issues there that in the Persian Gulf that we're going to have to deal with right now. China's doing some expansionism in the South China Sea that they may be trying to take advantage of this right now. And so all geopolitics are being affected by this for sure. But relative to supply chains, we're going to see, I think, some dramatic changes depending on where it is, where the supply chain was originating and what the product specifically is.
That's so good. Thank you for that. Randy, I see a question here. Thanks for your encouragement as well, Randy and Carol. There's a question here that says, is there anything in Bible prophecy that speaks to the pandemic?
Mm.
I think we've addressed this idea of Old Testament. Is this a plague? You addressed that as I think the first question we went by. I would love if you speak to maybe towards maybe the end of Scripture, as you look towards end times. Is there things that you see inside of this as people are wondering, what is God doing in the midst of this? And how do we find this in the story of Scripture and the story of God's redemption of his people and ultimately second coming and all of that? Maybe speak to kind of the Bible prophecy, a part of COVID-19 as well.
You bet. Now we can get real complex real fast, can't we? You know, and everybody will be hanging up in about 30 seconds. When I tell you there are 7 different approaches to the question of end times prophecy held by conservative scholars. I won't take you through all. I won't take you through any of them, much less all of them. But I will tell you that you could boil them down to 2 basic approaches. One approach that would say the book of Revelation is a forecast of the end of history. That's a very popular approach in Texas. Others that would say that's not the right way to read the book of Revelation. On that first approach, you'd be looking for current events and trying to locate them within specific prophetic statements, whether that's Revelation or something in Zechariah or whatever. On the other, you wouldn't be reading current events in that way through that prism. So for people on that approach, they wouldn't be asking that question so much. For people that are used to seeing current events in the context of end times prophecy, they'd be asking this kind of a question. Those that really interpret Revelation that way that I'm aware of are not seeing it that way. They're not seeing this in that context. I've looked at, that was one of the first things I wanted to know was, were people that see Revelation that way going to see this in that context? And I'm sure I could have missed somebody. Obviously, there's a lot out there, but the ones that I'm not aware of anybody that is seeing this as specifically relating to one of the plagues of Revelation, let's say, or the locust, let's say, or some such as that. I'm not aware of anybody seeing it that way because they just don't think other conditions are in place as well. They think that some other things have to happen before the plagues would happen, that this would be a part of. Some would say there has to be a rapture first before you get into the Great Tribulation, and that this would be relative to passages that be in the context of tribulation from Revelation 4 to 19, that Great Tribulation section. And there hasn't been the rapture yet, we trust, we assume. And so therefore this can't be that, is the most common way people are looking at this. And there's some others that are trying to find some places in Zechariah, but they don't think it actually fits. I would say this from a prophetic perspective. Jesus said in Matthew 24:14, the gospel must be preached to all nations, and then shall the end come. Well, as we said before, there is an openness to truth right now on a level unprecedented in my lifetime. The Sunday after 9/11, the church where I pastored in Dallas was absolutely packed. But 3 weeks later, it was back to so-called normal. Well, this isn't that. This is a pandemic that is certainly going to on some level be with us this year and maybe beyond that. We're going to see spikes probably in the future on some level with this. People are more aware of mortality than they perhaps were. Great spiritual awakening to result from this. That's really one of the takeaways from today, is to ask you to join me in praying for a great spiritual awakening as people are more admitting of their mortality and their need for God's help, their need for outside help that we can't get through science and medicine and all of that, and just trusting God on a new level. I'm praying for that. Well, to the degree that we have that kind of awakening, to the degree that more and more people hear the gospel, to the degree that technology allows us to preach the gospel to more people than ever, you're getting closer and closer to Matthew 24:14. The gospel must be preached to all nations, and then shall the end come. So I'm not saying it's hastening the return of the Lord. I don't know enough to say that, but I am saying the more we take advantage of that, I know, whatever of the 7 positions on Revelation you take, that I know we're called to do, because the Great Commission that everybody agrees is our commission tells us to make disciples of all nations. So let's take advantage of it. When we take people to Israel, we always go up to Megiddo and we look at the valley of Megiddo or Har Megiddo or Armageddon. And we talk about Revelation 16:16 and Armageddon. And after we talk about some of this, I always say to the group, the Lord put us on the preparation committee, not the planning committee. One thing I do know at the end of the day, relative to prophecy and COVID, is we're one day closer to eternity than we've ever been. And we only have today to get ready. Even if the Lord delays his coming by 1,000 years, I have no promise of tomorrow from COVID or something else. And so that's the bottom line practical takeaway, is to preach the gospel to all nations, starting where we are right now.
That's so great. I love to reference again, just and thank everyone here as donors. There is an unprecedented hunger an interest and desire for not only resources that help people related to health or their businesses, but also related to their connection to God and themselves and others right now. And so in March alone, I think we resourced about 3.3 million people as an organization, and it's your support that made that happen. And to demonstrate the uniqueness of that, as we monitor the trajectory of, say, podcasts, for instance, as rhythms went away that are normal for people to consume podcasts, whether they're going to the gym or commuting to work, whatever it might be, podcast trends plummeted across March. But Denison Forum had its tripled its highest day ever in March, as people are leaning and looking for content that helps them understand where this is going, as well as content that helps them connect to God in a meaningful way. And so your support is making that happen as we seek to resource people to be able to take this opportunity that does exist to be able to meet the appetite that's out there that's related to spiritual hunger. And so
absolutely. By way of scope and scale, Craig, if I'm remembering right, a year ago, our combined audience was 675,000.
That's correct.
And now it's 3.3 million in a year.
Yes.
And we're just so grateful for the privilege of doing that. But we really believe that this ministry is here for such a time as this. That we're a digital ministry at a time when, if we weren't digital, it'd be so hard to do this. That we have donors who have been so gracious to help us to be able to reach people at a time like this. We are now thinking that 11 years ago, when God started this ministry, this was part of it, is so that we could be in place to speak biblical truth and to call people to Himself at this time of crisis. And again, our donors make all that possible.
Yeah, so thank you for your support. And we've been celebrating and thanking God for you as we've been working hard across this pandemic. And so take the opportunity to say thank you in this context as well. There are a few questions that speak to what you were addressing, Dad, around where is this going related to faith? What opportunities exist in here related to spiritual awakening? So Joe Colanetta, thanks for your question. Thanks for being here. Asked, do you believe God will use the crisis for spiritual awakening to bring the country together? There's another question from someone anonymously that says, my question is whether or not you believe you will see the churches of America filled to overflowing after the COVID-19 is behind us, as the churches were after the 9/11 nightmares were lived through. Maybe if you want to speak to where this is heading related to the church and how you see the opportunities that churches are. You referenced one opportunity that's significant, but maybe speak to that trajectory as well of where you see this going. And even for us as church goers, as church leaders, as people that are invested in where God is mobilizing His mission through the church, how we can maybe even partner in some of those ways that you've seen the church be able to remobilize their efforts to meet this the need in this pandemic.
Absolutely. Very, very practical question. One of the things our ministry sponsors is called A Pastor's View. It's a weekly blog to pastors and a monthly teleconference, and I do a white paper that's part of it every month as well. We were doing a conference call about this just recently. We'll do another one next week. I have about 3,000 pastors from around the world that are part of this ministry right now. And that's, of course, their question. Where's the church going in this? What's going to happen on the other side of all of this? So I'd speak to it on two levels, on the present tense and in the future tense. In terms of the present tense, my encouragement to pastors is the same thing we've been asking ourselves. What can we do now that we couldn't do before COVID? How can we be used by God to take advantage of this opportunity to reach people in ways we couldn't do it before? I mentioned the church in California with 1.3 million on their Easter service. I'd mentioned a church in Houston that for years has especially focused on family. That's been really their bullseye. That's been their missional call. And the community has known that for years. Well, overnight, people wind up homeschooling kids. People have all these children at home and don't know what to do with them and how to handle that. And the pastor told me that they've had thousands of people in the community reach out to their church asking for resources. Overnight, the church muscled up and put all their stuff online, made it available for free, of course, and they found themselves ministering to thousands of people they weren't reaching before because of COVID, because of God using this in that way. So I'd be asking a church, what could you right now be doing to reach people you couldn't reach before? A lot of that's digital technology, making your services available to people everywhere, not just the people that can drive to your campus. I'm aware of a pastor that has found a senior adult ministry to think that they're being more effective in serving each other through online means than when they had to get in the car and drive down to the campus together. And they're saying past this, they would have never said that before, but now they're saying they want to keep doing this. They want to keep doing their Bible study online. They want to keep doing ministry online. They want to keep touching each other online, to just check in with each other and be able to minister to each other in ways that don't require distance, that transcend distance, all that. So that's one category. What could we be doing right now to take advantage of this? On the future side of all of this, do I think churches will be filled to overflowing like they were after 9/11? I'm hoping so for sure. I'm absolutely praying for that to be the case, at least in the short term, as people are just so glad to be together again, able to see each other together again, all of that. But we don't know what that looks like. We don't know if, for instance, this is going to be a graduation where at first you can't have any more than 50 people in the room. They have to be 6 feet apart. There has to be social distancing inside that. You have to take temperatures before they can come in. There's talk of some kind of a band that you would wear after you had an antibody test that proves that you have immunity to this, and you'd let those people in. You would let in the first 50 in your fellowship hall, and the 51st person has to get turned away. It won't be like 9/11 in that everybody can just show up that wants to show up. The practicalities of that are going to be very, very difficult. One thing I'm not afraid of that some pastors are a little concerned about is right now you can stay at home and watch any preacher in the country. And so they're worried about competing with these pastors that have these national ministries and these extremely well-produced worship services, whereas they're doing Facebook live streaming to try to provide a service, for their members, and they're worried they're going to lose them permanently. I don't think that's going to be the case at all. I mean, obviously some will, but I don't think that'll be the pattern. I wrote a paper for the pastors this past week talking about church as community. Every image of the church in the New Testament is a collective image, a body with many members, a vine with many branches. That's God's image of the church. It's not an individual consumer sitting at home in their pajamas watching a service. And I just think the Spirit of God is going to be drawing us together. You take a coal out of the fire and it goes out. That's Satan's strategy, to isolate the church, to divide the church, to make us too existentialist rather than being as communal as we need to be. I just think the Holy Spirit is going to be drawing us together in some really remarkable ways. Whether it will be a post 9/11 probably depends on the practicalities of it. How many people can we have in the room? How do we navigate all that? But on the other side of that, my prayer is that there will be a genuine societal, deep-seated spiritual awakening, not just an attendance revival, but a genuine spiritual awakening. And I'd ask you to join me in praying for that.
Wonderful. Okay, well, as we move to wrap up, I know there's so many questions here that are still open, unanswered, some amazing questions inside of there. And so we'll try to do our best to be able to get the answers to your questions out after this phone call is over. Thank you all for being here. If you guys could hang on for another 8 minutes, I want us to be able to have a time as a group of people just to pray for God to be able to speak to us, to keep us healthy, to keep us safe. To be able to move in power in the midst of this as a group of people with faith that God does move at the sound of our voice as we gather together to pray with faith that he is doing things in the midst of this, that some of which we can see, most of which we can't see, I think, to work towards the redemption of this pandemic that he has allowed. And so before we jump into a time of prayer, I want to let you know again that we are here for you. If you need someone to pray for or with you, don't hesitate to reach out to us. You can reach us at contact@denisonministries.org or our phone number 214-705-3710, 214-705-3710. Feel free to call us, email us. We would love to be able to pray for and with you specifically in this season. And thank you again for partnering with us. The ways in which Denison Ministries is able to resource people through Denison Forum, First a Teen, through Christian Parenting, the other things that we do would not be possible without your support. And so we're so grateful for you and the fact that your support has empowered us to be able to have the impact that we're having in this season in the midst of such great need. So let me pray for us and then we'll wrap up our call together. Heavenly Father, as we wrap up this time of spiritual connection, of communication, even in the midst of being physically distant, Lord, we do recognize that you are moving in power in ways that are seen and unseen. And Lord, we give the weight of this to you. And we thank you that your yoke is easy and your burden is light. We do ask in the midst of all of this, God, that you would inspire us, resource us, empower, equip us to be able to care for our neighbors, to care for our families, to care for ourselves, our businesses, to care for this world as co-laborers with you, as we seek to advance your kingdom into every corner of the earth and every corner of the human heart. I ask for everyone here on this call, God, that you would keep them safe and healthy, that you would provide for them, their families, and their businesses. Lord, even as I pray, the image of the bronze snake lifted up by Moses in Numbers 21 comes to mind as this group of people, anyone that was bitten by the snake, looked upon this image of a bronze snake, that they found healing. And we know that that's a prophetic symbol for you, Jesus. One of the things that you took on your shoulders when you were up on the cross high and lifted up. We know the things that you took on as you died a sinner's death on our behalf, and how, God, how your presence was made available to every single one of us across the earth as the temple curtain was torn in two from top to bottom. And Lord, we know that you are working ultimately for the healing and redemption of every person. that at the end of Revelation, as we talked about in times today, even Lord, it says that they're a healing for the nation, and they'll be used of the tree that's there in the alongside the river, in the ultimate New Jerusalem, the new earth, and new heaven that you're creating for us, or that you will create for us. And so we trust, God, that as we look to you, that you are moving in healing, moving in power, moving in redemption. May that be true in our lives as we open our eyes to be able to see you clearly and invite you to do a powerful work in our midst in this season. So we do pray right now in faith that you would bring this pandemic to a close. Ultimately, Lord, that you would use it for the salvation of people, for the redemption of people, for the drawing of the world close to you. Would you give us creativity and ideation and vision as your people to be able to look for new opportunities that are presenting themselves in this season, and the courage and boldness to take hold of those opportunities. And Lord, may we look back on this pandemic and see you so clearly in the ways that you were working miraculously, supernaturally, powerfully in the midst of your people and in every corner of the earth, to be able to care for those that you love so much, Lord Jesus. Thank you for opportunities like this with digital technology, to be able to connect together, to hear from people like Dad and the wisdom that you've given him, the sermon and insight that you've given him. Lord, would you move in power in this season for your glory and our good? In your name we pray, Jesus. Amen.
Amen.
Thank you all for being here. Don't hesitate to reach out to us if we can help you in any way. And again, we'll try to reach out with answers to these questions that were unaddressed today as best as we can. So thanks for the time. Dad, thank you again for making the space to speak into where this thing is heading with such wisdom and insight in the sermon.
Yeah.
Really,
What an honor to do this. Next time we do this, Craig, I do think the only suggestion I could make is that Wes and Wells need to be on camera. I'm sure they would do great for an hour, don't you think? Sitting in front of the camera quietly for an hour?
That would be beautiful and chaos.
That's right.
At the same time. Yeah. Yeah. Which is a little bit what life looks like right now for all of us, I know.
That's right.
As wonderful as it is. Yeah. Yeah. Amazing. Well, everyone, thank you for being here. Dad, thanks again. Have a wonderful rest of your day. Don't hesitate to contact us if we can help you in any way. And thank you.